are the main signs of Pes Anserine bursitis, that is bursitis in the knee. Now, usually when we think of bursitis, we think of areas like the elbow, etc. However, it is possible to get bursitis in other areas such as the knee. Rather, it's not very uncommon to have knee bursitis. So, before we jump into the topic, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage the aches and pains that come from being a mom. Now, this could be back pain, neck pain, heel pain, a poor posture, or a weak pelvic floor that leads to incontinence and other issues that starts either from the days of your pregnancy, childbirth, to being a mom, running after your toddlers, or little older when you're taking them to classes, etc. Now, usually moms are busy people, and hey, I understand we don't all have time in our daily schedules to look after our own selves, and sometimes we tend to put our aches and pains into the back seat. And this is where I come in and help you manage these within the existing routine or everyday activities that you're doing, so you don't have to take out a chunk of your time to manage these aches and pains. Sorry, got a bit of a sore throat. Yeah. So let's go back to the topic for today. What are the main signs of knee bursitis, namely Pes Anserine bursitis? Now, Pes Anserine basically is an area in the inner part of your knee. So if you look at your knee joint, when you bend your knee, so suppose you're bending your knee. So if this is the joint, right? So you look 2 to 3 centimeters below the knee joint on the inner side. That is a bony area known as pes anserine. Now, the reason why you get bursitis, okay, let me just tell you very quickly. This is the area where three of your muscles are attached. So, the inner thigh muscle, one of the inner thigh muscles, a part of your hamstrings, and another muscle that comes across your thigh. So these are three muscles that are attached at this bony point. Now, because these muscles are attached onto the bony point, there is a little fluid filled sac here, which is known as a bursa, that is sitting in this area so that you don't have much friction on the bone here. So, your leg bone, and then your bursa, and then those three attachments as well. So this is what makes up this area of the pes anserine. So sometimes when there's inflammation, swelling, and pain in this bursa, this is known as a bursitis, and in this area, it's called a Pes Anserine bursitis. So, if you go to the doctor and he gives you this diagnosis, there's nothing to be alarmed about. And I'm going to tell you what other symptoms that you or signs that you can sorry, that you can expect in this condition. So, apart from what I mentioned about the pain and swelling in this area, usually if you bend your knee against a resistance, for example, you're on a bicycle and say you're climbing uphill, or if you're in the gym and your resistance on the bike is a little on the higher side, so you're pushing your pedals against a resistance, so the foot pedals against a resistance on the bike, that will initiate the pain on that inner knee. Usually, when it comes to inner knee, people will think about ligaments and this causes. This bursitis is also one of the common causes of inner knee pain. Now, just looking at my notes here, yeah, another thing is usually when you're sleeping, your sleep can be disturbed depending on what is the stage and how much involvement is there, especially when you're sleeping on the side and your knees are like stacked on top of each other. You will and the knees are sort of rubbing against each other when you're lying down on the side. It can initiate pain in the inner knee. A tip here is to use a pillow in between your knees if you're a side sleeper, and try not to sleep on the affected side. So, for example, if you have right side bursitis, try to sleep on your left side, so your affected knee is on top and not being pressed down below. Okay, so usually now another symptom here is, yeah, so repetitive stress or friction can cause this bursitis. I will do one thing. I will do another video on what are the causes of why and how you can get this bursitis. But just to briefly touch upon the causes in this video, is your runners or swimmers usually tend to get overuse of the pes and serine area, because these three muscles that are attached to that inner knee are used quite a fair bit in these sports, right? So it is one of the causes for this bursitis is overuse. The other one is repetitive stress. And because of that repetitive stress, the fluid in the bursa that is normally present will get the inflammation, and you will get that swelling when there's excessive fluid in that area. Okay, so this was all that I wanted to cover about the main signs of knee, that is Pes Anserine bursitis. And if you're looking for more topics around the knee joint, I've been doing a couple of them in my last few videos. So you can go to my YouTube channel and you can have a look there. I will leave a link in the description of this video for my YouTube channel. There are lots of other topics around there as well that usually mums would suffer from, ranging from spine to joint pain. So we're looking at neck pain, back pain, etc., tennis elbow, golfer's elbow, etc., etc. So you can go onto my YouTube channel and have a look there. And the next video, I will cover a little bit about the causes and why you get Pes Anserine bursitis, and a little bit about how you can manage this condition at home. Alrighty, I hope that was useful for you guys.